the Center for Disease Control and Prevention published in July of 2012, 30% of all prescription drug overdoses were caused by the drug methadone alone. Everyone here has probably gone to the doctor with some sort of ache or pain, and you've been prescribed a pill or a drug of some sort, and you've ingested that. And by doing so, you trusted the doctor with the prescribed amount that you were given. The Food and Drug Administration should create a system of only distributing the drug methadone in rehabilitation centers. First, we'll be looking at the problem associated with the drug methadone, and lastly, we'll be looking at a solution to the problem. Methadone used in hospitals is causing a huge rise in methadone overdoses. This rise in overdose is caused by a couple reasons. First, it's caused by the fact that methadone is actually used to treat heroin addictions, which is kind of hard to believe. And also, there's been a large amount of doctors actually incorrectly prescribing the amount to patients. As stated by the Federal Regulation of Methadone Treatment in 2013, and by Deborah Cox in the New York Times in July 2012, and finally by the U.S. National Library in January 2012. The drug methadone is so dangerous because it is so easily accessible. Other drug addicts who are seeking the drug that they are addicted to must go to a drug dealer to get that drug, but methadone is so much easier. All you have to do is go to the doctor, claim to be in some sort of pain, and the doctor will prescribe you that drug. And some addicts will go as many as 5 times a week, getting full pill bottles and ingesting those in that amount of time, which is quite staggering. Also stated by the aforementioned Federal Regulation of Methadone Treatment and by the aforementioned COTS. Many people assume that methadone is okay to take because it is less addictive and dangerous than heroin. This point of view is brought on by the fact that methadone is actually used to treat heroin addicts. And this is really crazy to believe that a drug could be used to treat another drug. The reason why is heroin is one of the most addictive drugs out there. It is a form of an opiate drug. And opiates can cause such severe withdrawals that it could cause coma or even death. Methadone can actually prevent these withdrawals from occurring when taken off of heroin. So I guess you could say it is less dangerous, but methadone is still a drug in its own right, and it can still have the same results in the end, and that's death. It was stated in the aforementioned U.S. National Library of Medicine, a man brought his son to the doctor with nothing more than a sprained ankle. The doctor prescribed him some painkillers, and later that night, that son had died from a methadone overdose because the doctor had written down the prescription amount incorrectly. And that could happen to any one of us at any time. Methadone is becoming a huge problem because there are so many deaths caused by it, as stated by the aforementioned Center for Disease Control and Prevention. 30% of all prescription drug overdoses are caused by methadone alone. Also stated by the aforementioned COTS, U.S. National Library of Medicine, and by Rupert Shepard in the Medical News Today in July of 2012. Methadone overdoses have become 6 times more frequent in the last 10 years. That's a staggering amount. Also stated by the aforementioned COTS, currently in the United States, 1,500,000 heroin addicts are receiving methadone to treat their addiction. That alone could almost be the size of the state of Minnesota. Methadone overdoses are quite harmful to society. As stated by all of the above sources, nationally this is a problem because there's an increase in death due to an unnecessary and preventable cause. Also stated by the aforementioned U.S. National Library of Medicine, this is harmful to users too because they are not given a fair chance to actually treat their heroin addiction. It's just simply being masked versus actually going to the heart of the problem. And this can also be a problem for hospitals because they have to waste time treating these heroin addicts who go in with a fake pain, sometimes even once a day, to get more and more pills when there's probably another patient out there who could have really used that doctor's help. So now we just looked into a problem, and now we're going to look into a possible solution. The Food and Drug Administration should create a system of only allowing methadone to be distributed in rehabilitation centers. There are already laws out there pertaining to restricting methadone, just like there are for all other drugs, but they're just not enough, and they're not working well enough. This problem just focuses on how we're going to treat heroin addicts, which is a big part of the problem. This idea will be that heroin addicts will have to go to the rehab center to get the methadone that they are seeking because they do need it to treat their addiction. But in addition, they're going to be required to attend 1 hour of rehab for every 1 bottle of pills that they receive. So therefore, they're actually going to get real treatment. And in addition to that, strain will be taken off of the hospitals who will no longer be required to give this methadone to the heroin addicts who need it. This solution will be quite practical. Rehab centers do have the means to take care of drug addicts, whereas doctors do not. I mean, that's what rehab centers are built for. That's what they're made for. And this will be really easily enforced due to the fact that heroin addicts will have to go to the rehab center to get the drug that they are seeking. They'll already be there, and then treatment will be ready there to give it to them. And this solution is quite desirable. Methadone overdoses have caused an increase in death, and that's not what we want. In addition to that, heroin addicts will actually have a real chance at recovery, and strain will be taken off of hospitals who are already so very busy. So methadone overdoses have increased greatly in the last 10 years. And this solution actually gives heroin addicts a chance to really be treated versus just continuing to mask their problems by only alleviating the withdrawal symptoms. So the Food and Drug Administration should create a system of only allowing heroin addicts to receive the drug methadone at rehabilitation centers. So the next time that you go to the doctor and you're prescribed a painkiller of some sort for whatever ache or pain you have, will you think twice before you take it and trust your doctor, because that pill could just be your death sentence.